Hello, my name is Brittany Roberson, and today I'm going to be doing a head-to-toe assessment on you, okay?
Alright.
So first I'm going to start off with inspecting the arms, which is the upper extremities. I'm going to first inspect the arms for any, I must inspect the color, which is brown. I'm going to inspect for any lesions, any dryness, peeling, cracking. I'm going to palpate the skin. The skin is warm, dry, intact. I don't see any cracking, peeling, any pain, no edema. In the extremities, I'm going to check the skin tuber of the skin, make sure the skin bounces back. Check for hydration status, which the skin is good. Any pain?
No.
Okay. Next, I'm going to move on to the other side of the extremity. Again, I would assess the patient bilaterally. I would inspect the skin for colors, lesions, cracking, peeling, which I don't see. I would then palpate the skin for any edema or swelling. Make sure the skin is warm, dry, intact. The skin color is brown. Check the back of the arm as well. Make sure that is intact, which I don't see anything. Any pain while doing this?
No.
Do you have any problems with your skin?
No.
Okay. Next, I'm going to move on to your lower extremities for your skin. I'm going to first inspect the skin. I'm going to inspect the color, which I said the color is brown. I'm looking for any peeling, cracking, redness, edema of the extremity. I'm looking for any veins, varicose veins of the extremity, but I do not see. So therefore, I'm going to move on to my exam. I'm going to palpate the lower extremities. Any pain or swelling?
No.
No. Again, no. No signs of peeling. Skin warm, dry, and intact. There's no edema. So next I'm going to move on to the next extremity. Again, I'm going to be inspecting the skin for any redness, peeling, any dryness, cracking, no edema. Is there any tenderness in the leg?
No.
There's no tenderness. And looking for any varicose veins, which I do not see. So next I'm going to move on to my exam of the head and the neck. So then I'm going to move on to the neck. I just want you to look at the camera for me. I'm going to inspect the head, inspect the size, which is a round shape. I'm going to inspect the scalp, make sure the scalp is clean, dry, intact. I don't see any swelling, redness, bruising. The hair distribution on the scalp, I see some alopecia right in the back. Next, I'm going to palpate the scalp. The scalp is warm. I don't see any peeling or flaking. Scalp is a little oily back here, but other than that, I don't see anything. Do you have any problems with your scalp?
No.
Any pain or tenderness?
No.
Okay, great. So next, also I forgot, when I'm looking at the lower extremities, I would also look for hair distribution, on the legs, which I didn't. It was evenly. I didn't see any signs of like hair loss or anything like that on the lower or upper extremities. So after I inspected the head, I'm going to move on to the face. I'm going to first inspect the face. I'm going to look at the camera for me. I'm going to inspect the face, look for make sure everything's symmetric. The eyes are symmetric, eyebrows, the nose, the lips, and the chin are all midline. Make sure that one side is not lower or higher than the other. Next, I don't see, I'm going to palpate. You relax. Palpate the sinuses and the lacrimal sac in the eye. Any pain?
No.
Okay. I'm just going to palpate around here. Any pain? No pressure?
No.
Okay. So next I'm going to move on to the nose, which is smell, and that is a cranial nerve 1. First I'm going to inspect the nose, make sure the nose is midline. Checking for any deviations of the septum, which I do not see. It's nice and straight. I'm going to check the patency of each nostril. Can you blow? Can you blow? And do you have any trouble breathing when I do that? Okay. And next I'm going to take my flashlight. I'm gonna inspect the tissue of the nose, which is pink and intact. I don't see any drainage or swelling. Again, there's no drainage or swelling in the nostrils. I'm just gonna palpate. So again, the lacrimal sac and the sinuses. Make sure you don't feel any pressure. Any pressure?
No.
Okay. So that is my assessment of the nose. And again, I would test the oculomotor one, which is smell, by bringing an object to you and you can smell the object, which I would take like something like a lemon or something like that for you to smell. Do you have any difficulty smelling?
No.
Okay, next I'm going to move on to the cranial nerve 2, which is the ophthalmic, which is eyes. There's 2 different tests to test the eyes. You have a Snelling's test, which you're going to look at a chart on the wall, which most doctors' offices have. Basically, you're going to test your vision acuity from a distance. The letters go from larger to smaller on a chart. There's usually like 9 lines. At first, they get you to read the highest level you can. They try to get you to go down. They'll test one eye at a time, and they'll test basically to see what's going on in your eye. If you wear any vision aids or contacts, they'll ask you to remove those during the exam so they can figure out what's going on. And then they have another test called the Rosenbaum test, which tests the near side acuity in the eyes. Excuse me. It's going to test the side vision, and that's again another test with letters. They'll do one eye at a time, and they'll test your acuity on the sides. All right. And I'm going to inspect the eye. I'm doing this assessment. I'm going to inspect the sclera, the tissues, make sure there's no bulging veins, no drainage, no puffiness around the eyebrows, the eyelids. I'm going to palpate around the eyebrows and around the eyes. Let me open. I'm looking at the eyelashes as well, make sure I don't see any drainage. I'm looking at the corneal light reflex in the eyes. Open your eyes big for me. Making sure the pupils are the same size, which I have 4 for the size of the pupils. I'm making sure they're reactive to light. I'm checking the sclera. Looking at the optic nerve. Again, I'm looking for any swelling or drainage that I do not see. Next, I'm going to do a couple of tests on the eyes. The first one I'm going to do is the confrontation test. You're going to cover an eye, and I'm going to hold up some letters, and you're going to tell me what you see, okay?
2. 3.
Okay, go to the next eye.
2. 5. 3.
Okay. Next, I'm going to do the uncover test, and I just have a blank sheet of paper. I'm going to cover one eye, and I'm going to check the reflex of the eye, make sure that it's not moving around when I remove the paper. And again, checking the reaction of the eye. Very good. Next, I'm going to test your cranial nerve 3, which is your ocular motor, cranial nerve 4, which is your trochlear nerve, and your cranial nerve 6, which is your abducens nerve. And those kind of go around with the ocular movement. They help you move your eyes back and forth, help with movement. I'm going to check a test called the 6 cardinal gaze test. It's going to test your ocular movement. I'm going to have you just look at me, and I'm going to do a test, and you're going to look straight at me, okay? Okay, and that was the 6 cardinal gaze test. And again, that tests ocular motor 3, 4, and 6. Those are the eye tests I have for that exam. And next I'm going to move on to the next cranial nerve, which I'm going to do the cranial nerve 8, which is the ears, which is hearing. First I'm going to inspect the ears, look for make sure they're symmetric. I'm looking for any drainage or swelling of the ears. I'm going to palpate behind the ears. I'm gonna move the ears back and forth. Any pain?
No.
Okay. I'm gonna then inspect the internal and external meatus of the ear. I'm looking at the tissues inside the ear, making sure all the structures look okay. I'm looking for any drainage, puffing, swelling, edema that I do not see. I'm going to check the next ear. Again, for any drainage, swelling, puffing, edema, I'm going to check the internal and external meatus. I'm going to palpate behind the ear. Excuse me, move the ear back and forth. You don't have any problems hearing?
No.
Okay, I'm going to test your hearing by checking two tests. It's called the Weber's test and the Renan's test. I'm going to place first do the Weber's test, and we're going to test vibration. I'm going to place this in the front of your forehead, and you're going to tell me where you feel the vibration, okay? You ready?
Mm-hmm. In the middle.
Okay, and that's the Weber's test. Next, I'm going to move on to the Renan's test. You still feel the vibration?
Yes.
Okay.
Yes.
Okay. And that was the Weber and the Renan's test. Next, I'm going to move to the cranial nerve 7, which tests basically facial expressions. I'm going to have you move your eyebrows, look at the camera, move your eyebrows up and down. I need you to smile, frown, poof your face out, poof your lips out. And then I'm going to have you stick your tongue out like this. Any problems? Alright. Next, I'm going to assess your cranial nerve 5, which is your trigeminal nerve, which is the jaw movement. Okay? Can you look at the camera for me? I'm going to just palpate the jaw. Any pain? I'm going to do a sensation test. You're going to tell me what you feel, if it's hard or soft, okay?
Alright. Soft. Hard. Soft. Hard.
Alright. And then I'm going to have you move your chin back and the jaw back and forth. Right down. Move all the way to side, and that side. Any pain?
No.
You having difficulty eating?
No.
Okay. Next, I'm going to check your cranial nerve 9, which is your pharyngeal, which is basically the excuse me 1 second, the pharyngeal-esophageal nerve, which is going to test your swallowing. So can you open your mouth for me? Open wide, please. I'm going to inspect your tissues in your mouth. I'm checking the teeth, make sure they're all lined up, looking for any cavities, puffiness, whiteness, drainage, any swelling. Looking at the hard plate and the soft plate, looking to see if I see any redness, puffiness, swelling, any bleeding. Make sure the tissues are nice and pink. Can you say ah?
Ah.
Alright, stick your tongue out for me. I don't see any redness. I'm looking around the lips as well. Make sure I don't see any peeling or cracking. The teeth are white. The gums are nice and moist. So you don't have a problem. Do you ever experience dry mouth or anything like that?
No.
Alright. So next I'm going to move on to the vagal nerve 5 again, which tests the swallowing. Can you swallow for me? I'm checking to see if the trachea is midline. I'm going to give you some water. Okay. I'm checking to see if the trachea moves, which it does when he swallows. I'm just going to palpate the lymph nodes and the neck. You said no swelling. Okay, next I'm going to check your cranial nerve 11, which is your spinal. And I'm just going to have you push up on my hand. Okay, and that's just going to test the spine and the nerve right there. So basically